So what we can do is we can actually integrate all three of those things together, and we can understand how someone is intending to move.
Hey everyone, my name is Dr. Nick Housley with Motus Nova. I'm a licensed neurophysical therapist and neuroscientist helping brain injury survivors understand how to make functional gains after their injury. I hope this video helps you in your recovery.
Well, I don't fully understand how it works yet, because I also have a MyoPro, and it uses EMF sensors, and it senses your muscle contractions, and then uses a motor to open and close your hand. Now I was wondering, how does the Motus Nova know that I'm trying to open my hand?
It's a good question. Yeah. And so with respect to the MyoPro, you have those electrodes on in your shoulder, right? Your shoulder and your deltoid, right?
They're in for my hand and my flexors down here, and then my bicep and my triceps. I have their newest model. It's fully equipped.
Okay. Sure. Yeah. So the interesting thing about those systems are they do require some volitional sort of motor control there in terms of the EMG activity, right? Which is basically a capacitor detector for your muscles. And what's interesting about those systems is they're a little bit different than the kinematic-based systems that we have. So we've got the ability to detect fine gradations of movement, and those can be induced with a number of different reasons. But we can actually detect small amounts of movement and small deviations in muscle forces. So we use both kinematic and kinetic signals to derive a intuition about someone's intent to move. And that is how we actually condition the assistance that someone is then delivered. And the sort of third metric too is that we know how the virtual environment needs to be operated. So what we can do is we can actually integrate all three of those things together, and we can understand how someone is intending to move.
Hey, if you're finding this video helpful, please hit like and subscribe to help other brain injury survivors learn how Motus Nova is changing neuro rehab.
And conditioned on those three elements, we can then provide assistance to either help you initiate movement or to amplify movement. And so that is kind of how the base level functions work. I'm happy to go into any more details about that, specifically about how we look at deviations in range of motion and deviations in force and how their sort of interactions give us some insight. But those, I can get into the weeds in a hurry there. And so I may just pause there for a second and see if that makes sense.
Yeah, it does. But I just still don't, does it to detect your muscle contractions, or what does it do?
Well, it's detecting the consequence of a muscle contraction, right? So what it's doing is it's actually able to resolve the small gradations of movement, okay? And the nice thing about this is that it doesn't necessarily depend on the EMG sensors being on any one individual muscle, right? There's not one muscle that controls wrist extension, right? That doesn't exist. There's multiple muscles, and there's actually multiple muscles that have varying levels of depth inside of your arm. The same thing in our flexors, right? And having worked with EMG sensors for a long time and used them clinically and scientifically, they are frankly a pain in the butt to deal with, if I'm honest. There's a lot of variability in their function day to day. They're not exactly always stable in their performance. And what we do is we look at the consequence of the residual movement capabilities. And so we look at sort of all those muscles work together, and they then will ultimately result in some actual amount of movement. That movement we can detect with high fidelity, but we don't necessarily need to have a sensor on every single muscle to detect the consequence. We're looking at the sort of emergent property, if you will, of that joint muscle activity.
Thanks for watching this video. If you have questions or would like to speak with me about how you can make functional gains from home, call or text me at 404-939-3476 or visit motusnova.com/contact.